Hey guys, welcome to another video on my channel Hairliciously. I hope all of you guys have been doing great. Today in this video, I wanted to cover the topic of shock loss after a hair transplant. A lot of people are worried that right after a hair transplant, they're going to be suffering from shock loss, which is pretty much damage due to the trauma on the scalp, which can lead to premature hair loss. It doesn't really affect a lot of people. It's pretty uncommon, and based on some of the things that I've been researching online, it seems like only about 5% to 10% of people do end up suffering from shock loss. So if you guys don't know anything about hair transplants, there's two different methods. We have the FUT and the FUE, where FUT involves cutting a strip from the back of the scalp in the donor zone, where it's normally from ear to ear, and then those hairs are going to be cut up and then implanted into the areas where you're receding or balding. We also have the FUE, which is the method that I got, which involves a punch where the doctors are going to individually extract each hair follicle from the back of the scalp and then implant them into the recipient area. Either method is going to leave trauma no matter how well the doctor performs the surgery. And because of the trauma that's caused due to hair transplantation, many patients that undergo a hair transplant can experience what is known as shock loss. So shock loss pretty much means that the scalp undergoes trauma that causes the hair to fall out in response. And there's two different classifications when it comes to shock loss. We have temporary and permanent hair loss. Now, before I get started, let me show you guys some photos of what shock loss looks like. In this photo here, this person has had an FUT where a strip was cut from the donor zone. Notice how the loss of hair loss surrounding the suture line shows, and it's very thin. And moving on to the next picture here, shows a more severe form of hair loss and shock loss. Notice how the strip area looks very thin, and I don't think that this person was a good hair transplant candidate in the first place just by looking at how poor his donor zone and his hair density is. This is another good illustration of what shock loss can do after an FUT procedure, and this is another good photo of shock loss after an FUE procedure. Now, you can't see the scars that well like an FUT, but the FUE, notice how the thinning areas all throughout the back of the donor zone is affected. So shock loss can actually happen due to a number of reasons. As mentioned earlier, one of the most common forms of temporary hair loss or shock loss can occur because of hair transplants of any kind. When you're actually transplanting hairs into areas of the scalp that already have a number of pre-existing thinned hair, temporary hair loss can occur. This is because the graft is placed into the scalp, also known as the recipient zone, where the doctors first make a lot of little slits to put in the hair follicles, and the surrounding native hairs can actually be traumatized and fall out. And this is actually quite temporary, and it can actually occur right after a hair transplant procedure, while sometimes some people say that it actually occurs 3 months after a hair transplant. You just never know. Now, during an FUT procedure, a portion of the scalp is removed from the back of the scalp, and the hairs are then dissected and implanted. So once the donor zone has been extracted, it's going to leave a huge gap in the back of the scalp, and that's why the doctor would have to go back and suture or use staples to close up the wound. Now, if there's too much tension in the wound closure, then what's going to happen is it's going to disrupt the blood flow from this tension, and that can actually cause trauma to the hairs to the immediate vicinity or surrounding areas in the back of the scalp, and that can also cause shock loss to occur. Now, this is also normally temporary, and once the wound heals, then the hairs will tend to grow back. So the same thing also affects FUE procedures, because when you're extracting grafts from the back of the scalp, you can still damage surrounding hair follicles. And also when you're implanting them to the recipient zone, you can also have like pre-existing areas where the hairs can still fall out. The other thing that we have is permanent shock loss. Now, permanent shock loss isn't as common as a lot of people would like to think, but it does happen, and when the hairs are already predestined to fall out because of DHT, the hairs are not going to be growing at all. So there's a few things that we can actually do to minimize shock loss after a hair transplant, and one of the best preventions of shock loss is to be on hair loss medication. We currently have minoxidil and finasteride, and as you guys know, I do take both, and I also incorporate dermal rolling. But if you guys do end up getting a hair transplant, make sure to be on some type of hair medication before a hair transplant, because you want to minimize the hair miniaturization as much as possible so that it's not going to be affected and lead to shock loss. So the other thing that you guys can do is to find a competent hair transplant doctor who uses proper magnification, because increasing magnification during a hair transplant can actually help reduce transection. So transection is when the doctors are extracting the grafts from the back of the scalp, whether it's through FUT or an FUE. And if you end up cutting straight across the hair follicle, it's not going to grow. So you want to actually use a doctor that uses proper magnification to help reduce transection into the hair follicles, and also help make recipient incisions that are much smaller and refined to minimize trauma to the scalp. So this in itself can actually help minimize shock loss or hair miniaturization. And also the other thing is conservative placement of hair grafts instead of just dense packing into the scalp can also help minimize shock loss to an existing area. Overall, shock loss is mostly temporary, and a lot of people who actually do experience shock loss will have their hairs grow back. There is a small minority of people who do suffer from shock loss and the hairs just don't grow at all. And that's the case where the hairs were already predestined to fall out, and because of trauma and shock, it just sped up the process. In my experience, I didn't have any shock loss when I extracted 1,700 grafts from the back of the scalp. As you guys can see from my prior videos where I do updates, daily updates and monthly updates, you guys won't be able to see any type of shock loss because, like I said, it's not that common. And in my case, 1,700 grafts when it comes to hair transplantation is pretty conservative, and it's not a lot of hair that you're extracting and implanting. So there's not going to be a lot of trauma. It's not going to really affect the native hairs as much. And also, as you guys can see in my frontal hairline, there is a little bit lack of density. And sometimes if you just overdo the density, if you just jam pack everything, that can also cause and disrupt the blood flow to the scalp, leading to temporary or even permanent shock loss. So if you guys have any questions, let me know. If you guys can think of any other ways to prevent and reduce hair shock loss after a hair transplant, let me know what worked for you. And also for my next video, I'm going to be doing probably another celebrity hair loss type of video. So if you guys have anyone in mind that you guys want me to talk about, please let me know in the comment section below. Thanks for watching as always, guys. I appreciate all of your support, and I'll talk to you guys next time. Take care.